Hey there, it's me, Ames. I know this video is a long time in coming, but this year's been pretty crazy for me. My follow-up, I had a lot of video that I needed to edit, and it was pretty hard, and I had some flare-ups of my autoimmune disease. I had to go to war for my medieval reenactment group, and I had a lot of complications with my top surgery. And I felt like it was important for me to show that. Especially since a lot of the videos that are on YouTube are the people that have a really smooth time with hardly any problems at all, and I wanted to show you guys that. Just because of the amount of footage that I got, I'm probably going to split this video into 2 videos, so I'm really thanking you for your patience. But yeah, I'm now a year on T. As you can see, not much has changed. My voice is a little bit lower. I believe that this is due to my misdosing of my hormones. I had problems with the endocrinologist that I was with. Hopefully I'll be seeing a new endocrinologist soon, and that'll fix things. But other than that, let me tell you a little about my top surgery. The video that you're going to see right now has some graphic images in it. There's a lot of close-ups on people removing stitches from my nipples and things. I also have a little bit of a reveal photo video, but it's been extremely edited. My friend took the video, and I forgot to tell her to keep it in landscape and not portrait mode, so you're going to have to deal with that as well. But I'm doing the best I have with what I have, and that's just an iPad. So have fun with this video. This is just like the results immediately afterwards, and what you can expect your chest to possibly look like afterwards. And in the next video, I'll talk a little bit more about the complications I had, which I did have a couple of seromas, and I did spit a lot of stitches and staples, which is probably due to my autoimmune disease. So if you're a transgender person with autoimmune problems, this may ring a little bit more true with you than with everybody else. But like I said, I have those complications. Every surgery I go through, I have complications, and that's because of my autoimmune disease. So if there's any other trans people that have autoimmune diseases, I know there's not a lot of videos out there for you, but this may be a good video for you to watch. The next video will also be graphic because I had a hole in my chest for a while. And I'll show you what's going on now. And just a fair warning, I talk a lot about cake. I'll have a cake counter in the video. It's just that I really love sugar. So, yeah, I'll let you guys get to it, and I hope you enjoy the video. Like I said, this is your warning. There's blood, there's stitches, there's a lot of medical stuff. So, you'll also learn a little bit more about my autoimmune disease because I talked to my nurse about it. So if you're curious about that, that's there. Anyway, enjoy.
Hi, I'm Michelle, by the way, the person who's talking with the sexy voice.
Okay, let's see. Oh, I can breathe. What? Oh, I can breathe. Okay. Now I'm going to take off this extra padding. Okay.
Look at that.
Some here.
One more layer.
It's like the nastiest cake ever. Okay, and then this one, it might be a little bit sticky just from the secretions, but I don't know where it is in the area. Like here. Sorry. How's your pain? Pretty good. Okay. Sorry, it's just from the area, okay?
I've had my colon removed.
Okay.
We're okay. This is like a cakewalk.
Just don't peel off the nipple.
Okay. I'm just gonna like cut them.
It'll come off in the shower.
Exactly. I don't want to pull it too much for this. It's not necessary, you know.
Wow.
I'm just really gooey.
It's alright. because usually they put tape there, but obviously because you're allergic to it.
Yeah, they don't.
Yeah.
I have tape. I'm special. I'm a delicate lily.
That's okay. I didn't realize. I don't know what. I got burnt on my leg a couple of years ago,
Mm-hmm.
and I didn't think I was allergic to anything, but one of the dressings just sent my leg like on fire.
Oh, it's awful.
Oh.
I got blisters from Steri Strip once.
Yeah.
And then when they went to go into, because I had an adhesion, they had to go back in.
Mm-hmm.
I told them before they put me under, don't put any tape or Steri Strips on me. I'm allergic.
Yeah.
And they put it on, and I woke
Oh.
up, and I didn't notice because I was like on a pain pump for like a couple of days.
Yeah.
And then when they went to go change everything, I was like, oh yuck.
Yeah.
Your nipples turned yellow.
That's the iodine.
Okay, I'm gonna go this side. That's
Okay.
this thing. You want about
Yeah.
the dressing or?
Yeah.
Oh, sorry.
My little nipple cupcakes.
Yeah.
Okay, gonna take off the gauze. Sorry. Ah, stuck. So I don't want to pull at this too
Yeah.
much because this is glued.
Yeah.
So I think once you get it wet, it's gonna be easier.
Yeah.
Is that okay?
That's fine. I don't
Yeah.
care if I have like furry nipples.
Okay, so I'm gonna take off this yellow bolster dressing. I'm gonna snip these first so you won't feel it. They're on it. Doing okay?
Mhm.
Kind of want to remove it. Okay. So I'm going to start to remove the sutures.
Okay.
The big black ones first, okay? You might feel a little bit of a like tug, but it shouldn't be painful at all,
Alright.
okay? You just let me know. Is that okay?
Yeah, it's fine.
Can you feel that?
Yeah.
But it's not like very uncomfortable, is it?
No.
Okay, perfect. So now I'm going to start taking out the blue ones. These are really small ones going around the nipple area, okay?
Mhm.
Sorry. Okay. Shaky hands are not good.
Yeah.
Okay, perfect. Once I get the knots out, it's easier. Doing okay?
Mhm.
A little bit of blood is normal. It's just from taking the sutures out.
I'm pretty okay with blood, so you don't have to worry.
Okay. I'm sure after your total colectomy.
Yeah.
So did you have you had a stone?
Yeah. See, there's where it was. I have a J pouch now.
Oh, okay. So what, did you have that for like a couple of months? Well, I mean,
It was
like
supposed
9
to
months
be
or
for
something.
like 3 months, but I had a lot of complications, so I ended up having it for half a year.
Okay, yeah.
I ended up developing about 3 liter-filled abscesses inside my gut that they had to deal with.
You poor thing. How come you had the colectomy? What did you have?
They don't know yet, so right now they're just saying autoimmune disease, not otherwise specified.
Oh, wow. Okay.
But, and I can't get my insurance to let me go to Mayo. But it acts kind of like Crohn's, but they haven't found any ulcerations,
Gotcha.
so they can't diagnose it as Crohn's.
Mm-hmm.
But it's kind of like that.
Okay, yeah.
I also have an autoimmune kidney disease.
Yeah. I remember
So-
that you were telling me.
Yeah, just everything.
So this is like a piece of pie.
Oh, yeah. And I've got a bad pancreas too, like, you know, and the nurses are like, well, you better get used to being allergic to things because you're just going to get allergic to more and more things.
Yeah.
It's just the nature of having an autoimmune disease.
I know.
And I say that autoimmune disease means that only I'm tough enough to kick my own ass.
Mm-hmm. So with your kidneys, are you on what you
I'm in
do?
remission right now, but I did chemotherapy for a while. And my doctor actually told my mom when I was 14 that I wouldn't survive to graduate high school.
Oh my god.
Because I was spilling 7,000 grams of protein in my urine every day.
Oh my god.
Which, I mean, 150 is the max for adults.
Yeah.
So,
Wow.
and my GP is actually the one that saved my life because I went in for allergies because my eyes were puffy.
Oh.
And we were about to leave. He gave me some stuff for allergies and he says, you know, you're starting out high school. Do you want to get a sports physical? And I was like, I don't do sports. Are you kidding me? I'm a huge nerd. I'm just going to be sitting in front of the computer all day long. And he goes, well, you never know.
Mm-hmm.
You might get a friend. You might want to change your mind, and it's always good to have one. And I was like, no. And he's like, well, just have one. It's just, he says, you don't want to come back and have to do another one.
Yeah.
And I was like, okay, fine. And I did everything. Everything looked good. Did the PP test. And he says, you need to do another PP test. I'm not letting you leave until you do another one. I was like, okay. So I did another one. And he came back and he says, you need to go to ER. You've got immediate renal failure.
Oh my gosh, you find out right
So-
there and then.
Yeah. So if he hadn't insisted that I get a sports physical,
Yeah.
I'd be
You
dead.
would've- Oh my god. Wow.
Look at the smile.
Oh, I don't have to wear a binder ever again. That's gonna be exciting. Like, because I became allergic to elastic, I couldn't wear a binder for the last 2 years.
Wow.
So I just had to kind of, and then I couldn't wear like even a bra, like a sports bra or anything, because they all have elastic in them. I had to buy special underwear. I had to knit my own socks. Wow.
Hey, it just occurred to me that after watching that video, you probably wonder what that looks like almost a year later. I believe that I got the surgery in October, and it's July now. So, well, it's June 30th. It's gonna be July. So just let me show you how that looks. If I don't knock my glasses off my face. This is what we're dealing with. This is the hole where I spit a lot of my staples. You can see it healed a little bit crooked there, and I currently still have a seroma here. It's very small, but it hurts a little bit, especially when I do push-ups and things. But I'm probably gonna have to go get a revision for that. I do have some small dog ears, but they're not bad at all. Yeah, they're not too bad. But actually, this doesn't look too bad on camera, but like it's a significant squishy spot, especially when I look down on it and it kind of gets this like little mini boob thing going on. But anyway, I'm in the process of talking to Dr. Satterwhite. I have an appointment with him over the phone on August. He's going to talk to me, and we're going to see if we can't get at least this dog ear a little more minimized. See if we can do anything about this scar here, because it does dip in kind of like a bullet hole here. And more importantly, get this fluid packet taken care of. So, if you want to see more graphic stuff, or, I mean, not that anybody wants to see that, but it's the internet, I'm not going to judge you. But if you want to see the story about that, hopefully I'll be coming out with a video with that soon. Most of that will be a slideshow, because I took pictures of the process where I was taking care of the hole in my chest and how to heal it, because it did go pretty deep in there, and it was pretty gnarly looking. So, I'll put my clothes on, and regrettably, because I'm in Arizona and everything's melting out here. Sorry the video was so late, and I hope this helps somebody. Goodbye.